Millions of individuals in the United States and the United Kingdom who rely on acid reflux medications could potentially face an increased risk of dementia by as much as 1/3, according to a recent study. Published in the journal Neurology, this research, conducted by experts from the American Academy of Neurology, indicates that patients consuming certain types of acid reflux drugs, specifically proton pump inhibitors, PPIs, for a duration of 4.4 years or more, face a significantly higher likelihood of developing dementia compared to those who avoid such medications. The study centered on a cohort of 5,712 participants, aged between 45 and 64, who joined a health study in the late 1980s. These individuals were consistently queried about their medication usage up until 2011, when their average age reached 75. This data helped to calculate the extent of PPI use. Subsequently, the participants were tracked for an average span of 5.5 years, during which around 10% of them experienced the onset of dementia. The study's findings demonstrated that individuals who had consumed PPI drugs for more than 4.4 years faced a 33% elevated risk of developing dementia compared to those who had not taken the medications at all throughout the study's duration. The underlying reasons behind this potential correlation include the possibility of lowered vitamin B12 levels due to prolonged PPI usage, which could lead to cognitive issues. Moreover, animal studies have suggested a plausible link between these drugs and the accumulation of beta-amyloid protein in the brain, a characteristic feature of Alzheimer's disease. Dr. Kamakshi Lakshminarayan, the senior author of the study from the University of Minnesota, cautioned that further research is necessary to validate these findings and to elucidate the mechanisms potentially connecting long-term PPI usage with a heightened dementia risk. She emphasized that while various strategies exist to manage acid reflux, including antacid use, maintaining a healthy weight, and adjusting dietary habits, individual responses may differ. Dr. Lakshminarayan stressed the importance of consulting with medical professionals before discontinuing PPIs abruptly. Acid reflux, characterized by the backflow of stomach acid into the esophagus, often leading to heartburn and ulcers, is mitigated by proton pump inhibitors, PPIs, which target stomach lining enzymes responsible for acid production. Notably, the study did not identify any significant variance in dementia risk for individuals consuming PPIs for less than 4.4 years. Past investigations, focusing mainly on short-term PPI use, did not consistently establish a connection with dementia risk, which could be due to the prolonged timeframe required for dementia to develop. Despite certain limitations in the study's precision, such as the annual frequency of PPI inquiries, the research highlights the potential link between long-term PPI consumption and heightened dementia susceptibility. This correlation persisted even after accounting for factors like age, high blood pressure, and genetic predisposition. Further investigations are necessary to establish a more precise understanding of the relationship between extended PPI usage and dementia risk. Don't forget to like, share, and subscribe to our channel for more impactful content.